Hello. Welcome to my channel. In this video we will talk about cancer in adolescents. Cancer in adolescents. The word, cancer, actually includes many diseases, not one. In fact, there are more than 100 types of diseases known collectively as cancer. What they all have in common is the uncontrollable growth and division of cells, which are small units that make up all living things. Normal body cells grow and divide over a period of time until they eventually die. But cancer cells continue to grow and divide infinitely. Ultimately, they combine to form tumors. Tumors are lumps that can interfere with the body's normal processes. Sometimes tumor cells separate and spread to a different tissue or organ. This is called metastasis. Terrifying as all this sounds, most cancers are treatable and controllable, if caught early. Thus, many people with cancer can recover to lead normal lives. Causes of cancer. Nobody really knows why cancer grows in specific people. Scientists and researchers are working to find out why some people get cancer and not others. Inevitably, a better understanding of the causes of cancer will help in developing more effective treatment and preventive interventions. There are some genetic, environmental, and behavioral factors known to play a role in making people more likely to develop certain types of cancer. Some people may have a genetic predisposition to developing cancer. For example, if a relative has had breast or colon cancer, you will likely inherit a tendency to develop these cancers, even though you may never develop it. Many behavioral and environmental triggers can cause changes in the body's cells that cause them to become cancerous. For example, smoking is known to increase the risk of lung cancer. Excessive sun exposure can increase the risk of skin cancer. These types of stimuli work on the body slowly over time, so the cancers that may result from them do not appear until a person is an adult. This is one reason why teens do not develop the same types of cancer as adults. Doctors certainly know that cancer itself is not contagious, so you don't need to worry about it spreading from another person or spreading it to another person, although people with certain infectious diseases such as AIDS or hepatitis are more likely to develop some types of cancer. Cancer is never a person's fault either. It is simply not true that a person might have done something wrong to contract the disease. Cancers that affect adolescents. Although the incidence of cancer in teens is relatively low, there are some types of cancer that are more likely to affect teens and young adults. Osteosarcoma is a type of bone cancer that most often appears during growth spurts and tends to be more common in those who are taller than average. There is no known cause of osteosarcoma. Leukemia is one of the most common types of cancer in childhood, and it occurs when the number of immature or abnormal white blood cells produced by the bone marrow increases. This disrupts the normal cell activity in the body and reduces the body's ability to produce normal blood cells. The survival rate for leukemia patients is very high, with an effective treatment plan in place. Brain tumors can be either benign or malignant, and both can be fatal to the patient. A benign brain tumor can grow and increase pressure inside the skull, thus exerting pressure on certain areas of the brain, reducing their function and possibly leading to death. While a tumor can spread to other organs and disrupt normal body systems, many cases of brain tumors can be treated, but they depend on the location and size of the tumor that needs to be surgically removed and how early it is detected. Signs of cancer. The first sign of cancer is a symptom, an indication that something is wrong. There are many different signs of cancer, just as there are many different forms of the disease. Some of the more common symptoms of cancer include extreme fatigue or headache, swelling or lumps in certain parts of the body, such as the abdomen or neck, blurred vision, nausea, problems with walking or balance, unusual infections or bleeding. Only you know how your body works and what you feel when you are healthy. If you are not feeling well, it is best to tell an adult who can be sure to see a doctor who will evaluate your symptoms. Cancer, like most diseases, is easiest to treat when it's caught early, so when in doubt, check it out. If a doctor suspects someone has cancer, they will order various tests. This may include blood tests, where doctors examine blood cells under a microscope to look for abnormalities, X-rays, or magnetic resonance imaging, a scanning technique that can be used to detect tumors. Doctors often also use a biopsy to diagnose cancer. In this procedure, a doctor removes a small sample of tissue to check for cancer cells. Cancer treatment methods. Most types of cancer, especially the types of cancers that teenagers are likely to develop, are treatable if caught early. The number of people beating cancer every year due to new cancer treatments. There are 3 common methods of treating cancer: surgery, chemotherapy, and radiation. Because the cancer is different in each patient, the treatment plan will be tailored for each person. A person with cancer may undergo any of these treatments or a combination of them. A doctor who specializes in treating people with cancer is called an oncologist. Surgery removes the cancerous tissue depending on where a person has cancer. Surgery can be simple or complex, so the operation may be an outpatient procedure, where the person is in and out of the hospital on the same day, or it may require the person to stay in the hospital. Generally, the surgeon removes the cancerous tissue with a small amount of healthy tissue surrounding it to make sure that all of the cancer has been removed and that it has not spread. Treating cancer with drugs is called chemotherapy. Certain types of cancer respond well to chemotherapy, which can often be given on an outpatient basis. A person undergoing chemotherapy may experience nausea, fatigue, hair loss, or other side effects. Some of these side effects occur because chemotherapy drugs may destroy some healthy cells in the process of getting rid of malignant cells. Over time, these healthy cells will start growing again and most of the side effects will disappear. Radiation therapy is an additional method of treating cancer. A person treated with radiation therapy will likely be treated by a radiation oncologist, who is someone who specializes in using radiation to kill cancer cells. Radiation therapy machines deliver powerful X-rays or high-energy electrons to the affected part of a person's body. After repeated doses of high levels of radiation, many carcinomas shrink or disappear. Radiation therapy is generally painless, but there may be some side effects. Side effects of radiation therapy may include fatigue, nausea, vomiting, or diarrhea. Some patients complain that the irradiated area of skin feels sunburned, but most of these side effects are temporary. Cancer treatment. Dealing with cancer and cancer treatments can disrupt a person's life for a period of time. People with cancer often need support in all aspects of their lives. For example, teens with cancer may need the help of a home teacher to accomplish schoolwork, and adults with cancer may need help with housework or their jobs. Many people talk to professional therapists or counselors about the emotional aspect of dealing with a health problem. You may hear doctors talking about diagnosing someone with cancer. The prognosis is an estimate of how well that person's treatment will work and how likely the cancer is to return. In the end, please activate the bell button, subscribe to the channel, to receive from us all that is new. For more information about cancer in adolescents, please visit my own site. You will find the website link in the description. Thank you.